There are many things that you can do right now to prepare for the rest of your pregnancy, delivery, postpartum period, and beyond. If you haven't already, make sure to make an OB appointment and get started with your recovery journey. Early and regular prenatal care with an OB physician or midwife can make a big difference in your health and your baby's health. Tell your OB provider about your health history, including all substance use history, so that they can help you find the best treatment options for your recovery. Sometimes this means a short inpatient hospital stay to become stable, and sometimes this means continued inpatient recovery treatment or outpatient treatment, which could include counseling and medication. Misusing opioids during pregnancy can increase your risk of serious life-threatening complications, such as preterm labor, high blood pressure, or preeclampsia, which can lead to a seizure or stroke, miscarriage, or stillbirth. Sometimes babies are born small for gestational age. Your OB provider wants to help you have a healthy pregnancy and be well prepared to parent your newborn. Your recovery is a #1 priority.
There are safe medications that can help your recovery from opioid misuse, such as buprenorphine or methadone. This is called MAT, or medication-assisted treatment. These prescription medications are safe to use during pregnancy. The dose can be adjusted to meet your body's needs using a well-studied medication that isn't laced with toxins or other drugs. Parents in recovery who choose MAT during pregnancy have healthier pregnancies and fewer complications and tend to have average-sized babies. If you feel like you need inpatient treatment, there are other programs for pregnant parents and for moms and children to stay together while receiving treatment. If you would like other forms of support, consider enrolling in a peer recovery support program and/or home visiting program. You can do this in addition to inpatient or outpatient care. Recovery takes a village, and you are not alone. Ask your OB provider about these programs. You're building your support team, and your OB provider and community recovery programs work together to help you meet your recovery, personal, and parenting goals. During your pregnancy, you can work with your OB provider and support programs to develop a birth plan for your hospital stay. This may include choosing a reliable support person to help you in the hospital, planning childcare for older children, and discussing pain control options for labor and postpartum that will not interfere with your recovery. Eat, Sleep, and Console requires a longer hospital stay, possibly 4 to 7 days, so pack your hospital bag with this in mind. Before you go into labor, tour the hospital birthing unit and ask to meet with the social worker prior to your hospital stay. Planning ahead gives you confidence in parenting, makes you stronger in your recovery, and builds a community around you that is invested in your family's well-being. Please remember, you are not alone.
During the Eat, Sleep, and Console stay, the nurses and staff were so amazing. They made sure I had the information and the tools that I needed to be successful and to understand exactly what I needed to support my baby. They told me when to expect withdrawal symptoms to start and how to manage them, and how important skin to skin was for my baby. It was amazing to see and to know that I was able to settle my baby and that I am what he needed. I can't speak highly enough of all my supports. They were my cheerleaders and advocates and reminded me that I can do this and encouraged me along the way. With their reassuring presence and my resolve to move forward with my baby, I was able to continue my recovery journey for myself and for him. I was terrified of not being able to take my Judah home, but I had to learn to face my struggles head on and to be upfront and honest about everything. For me, this was an important piece of my recovery and growth. Everybody's journey will be different, but if you go into it ready to learn, having the best idea of what to expect, and trying your best for yourself and your baby, that is the best thing you can do. I feel so blessed to have Judah. He is my whole world. Making recovery my #1 focus made my life better and made it possible for me to be the mom I wanted to be. There is no more shame or guilt for me now. I give myself permission to make mistakes because I realize it is a part of learning and growing. I was scared to take the first step, but over time I learned there was a whole team of people wanting to support me. I really want the same for you. By learning about Eat, Sleep, and Console, you have taken the first step. Keep reaching out, you're not alone.